You hear me use the word restore. Okay, so what is it that we're restoring? So we talk a lot about the two autonomous nervous system, the sympathetic versus the parasympathetic. The sympathetic is what's commonly called the fight or flight, and then the other one is called the rest and digest. As it turns out, having that harmony between the two, the yang, which is the energetic, the sympathetic or the fight or flight, and the yin means the absence of the sun, is where you are activating the parasympathetic versus or the fight or flight, right? Different names, different languages. Okay, we have to learn how to live within different culture, different perspective. Okay, it's not that one is right, one is wrong. It's just that people look at things differently. All right. Now, so I posted an article. That's actually a bunch of articles. And I just posted the one that I thought is more comprehensive on a circle that talks about a recent study. As you know, dementia is the name, and then Alzheimer is probably like 80-90% of what we consider dementia. There's other parts that are not Alzheimer. But in any case, it's a degenerative disease of the brain. I happen to know that firsthand. My father died from that. Not just died, but actually dragged the entire family with him, causing a lot of pain and suffering and causing a lot of agony in him as he see himself being going through the degeneration. Anyway, it's a horrible disease, and it happens anywhere from 3 to 6, 1 hour 3 to 1 hour 6 of us as we approach a retirement age or beyond. Okay, so it's a very, 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 very terrifying disease. There's no cure. There's absolutely no cure right now. In fact, those of you who are receiving Social Security like I am, you will notice that there's an increase. Well, there's an increase in Social Security because the government gave you more, but there's also an increase in Social Security because the monthly payment that you pay towards Medicare has decreased, and the reason is that the government has decided to stop a medicine that they were experimenting last week, which cost about $10,000 one pill. That was how desperate the government were in finding a cure for dementia. But in any case, we don't know how to fix it. We're doing the best we can to understand it. We don't know the causality, although we are starting to understand the correlation. So there's a correlation between people who suffer dementia to certain marker in the brain, and it really ultimately tied to inflammation of the tiny blood vessel inside the brain. So they know what differentiate a normal human being versus one who's suffering from dementia. They know that they can test that, and so they went about and wanted to figure out what are the lifestyle changes that you can do to improve your chance of not having dementia. And somehow they focus on relaxation. And they decided that they would divide a huge population of people into two groups. One is normal relaxation, listen to the music, just chill, okay? The other one is, in addition to that, they introduce deep breathing. By deep breathing just means breathe in, breathe out. Nothing as sophisticated as what we do here. And what they find is that marker that they've been measuring shows a substantial improvement among those who does abdominal breathing. So they're trying now to find the link between deep breathing versus that part, and they ultimately settle into something called heart rate variability. What does that mean? Well, we all know our heart rate. I'm about 60 pulses per minute. Some are higher, some are lower, not much higher, not much lower than that. And we always thought that, well, then, maybe it's best that we keep it constant. Turns out that's not a good idea. It's not a good idea to have your blood rate to be constant. It's actually better to have it as a variable according to whether you are energetic or restorative. when you are in the energetic mode, when you're in the sympathetic mode, when you are fight or flight, you want your heart rate to be high. But when you're not, when you are in the restorative and when you are in the rest and digest, then you want your heart rate to be low. And so they turn out that the heart rate variability is the key to not only to the health of a brain, but to health overall. Now, that's how the Western scientists now are approaching this problem. Whereas the Chinese have understood that for thousands of years, and we call this the yin-yang harmony. We understood that. We understood that it's very important that when you exercise or when you do anything, whether you're outside a cave being chased by a lion, you want your adrenaline and your cortisol to be available. That's survival. But as soon as you're done, you come home, back to the cave, you want to be sure that you're back into the rest and digest. Unfortunately, in the last 60 years, modern people have lost that, not only as a luxury, but as an art. And so all we're trying to do here, and the reason I brought up this medical report, this not medical report, this scientific report, is to affirm what we're doing here. That is very, very important that we learn how to entice the body into the rest and digest. And so we do that in all kinds of ways. And the most effective way is to learn how to breathe with your lower abdomen. So that's what we're doing now. We're going to spend the next 10 minutes learning how to breathe with your stomach. Now, having said that, no one ever breathes the stomach. There is nothing in here that allows breathing. All we're saying is that we're using more of the lung capacity, using more of the diaphragm, so that as you breathe in, you learn to lower your diaphragm as if you're using your stomach. And when you breathe out, you learn to lift up your diaphragm as if you're collapsing your stomach. So it looks like you're breathing with the stomach, where in fact you're still breathing in the lung. It's just that you learn how to use your lung more effectively by training your diaphragm. Okay? It's the Olympics of breathing that we were doing here. Now, all starts with the body. So let's focus on the body. Mentally divide the body into 7 parts. The first are the legs. Think about your body as the bell, and the legs are the pedestal of the bell. The second part are your hands. Relax your hands. Rest it on your knee, rest it on your thigh, rest it on your calf, anywhere. Just don't rest it in air. Okay, don't do this. Okay, just rest it, because what you want to do is relax your body. You don't want to use any of your muscles now. Just use the weight of your body. The third one is the most important. That is the spine. I want you to focus on the top of the head as if someone is lifting your spine by lifting your top of the head towards the ceiling, towards the sky. So lift up your spine as if you're hanging the spine on the ceiling. Your spine becomes the little clapper inside the bell. Okay? Now relax the spine so the weight of your spine is on top of each other, and you're not using your back muscle to support your upper torso anymore. The next one is the shoulder. I want you to remember the 2 sets of energy points. The one in front is called the gate to the cloud. The one on top is called the well of the shoulder, like the water well. Now I want you to open, so you reveal the gate to the cloud. Now I want you to focus on the top of the shoulder, and then just relax the shoulder. Now the only thing that you're supporting with muscle now is your head, which is about 25% of your body weight. That's a lot. So I want you to focus on your forehead and lean back the forehead as if you're putting the bowling ball on top of a totem pole. Okay? So now the weight of the head is on top of your spine, except that the top of the head is pointing backward. So now what I want you to do is take your chin and then just gently tuck it in a bit, so the top of the head is on top of the spine. The top of the head is called the 100 meat. This is where all of the yang energy come together, and you want that to be on top of your central nervous system. Not only that, but you're putting a little bit of pressure on your 2 major arteries on the neck that's responsible for your having high blood pressure to begin with. Okay, so that's a good thing. Now I want you to focus on your eyelid. Relax the eyelid. You don't want to open your eye. You don't want to shut your eye. Think about the baby when they're sleeping. They're just so relaxed. So it's just so relaxed. So you can actually see your own eyelashes. You can see your knee, your hand, your floor. That's what you want. Finally is the inside your mouth. I want you to feel the inside of the mouth. Relax your teeth. Take the tip of the tongue and put that in where the teeth ends and the roof of the mouth starts. And it's actually right behind this energy point called the center of being. Close your mouth. And one last thing, I want you to be very grateful. Tomorrow's Mother's Day. Whether your mom is still alive or not, it doesn't matter. I want you to be very grateful of your existence, starting with your body and your health, and the fact that someone had given birth to you, as if you are giving, it's the same as you have given birth to someone else. I want you to be very grateful. I want you to show that gratitude in your face by lifting up the corner of your mouth as if you're smiling. That's just the preparation. Now I want you to focus on your breath, starting with knowing that I'm breathing in, knowing that I'm breathing in. I feel the air coming in through my nostril. Know that I'm breathing out. I feel the air coming out of my nostril. As I breathe in, I focus on the belly button, or more precisely, the energy point right below the belly button that I've been mentioning, called the Sea of Qi. And as soon as you know that you're breathing in, I want you to move forward. Your mind, as if you're taking your belly button and move it all the way across the room. Now the body will follow you. You don't have to force the body into submission. Just the mind. As soon as you know that you're breathing out, I want you to go all the way back as if you're taking your belly button and bring it all the way back. Now it turns out that there's an important energy point right behind. And it's as if you're collapsing the two energy points. That's all you need to do. It's a very simple thing. Breathe in, forward. Breathe out, backward. And if you find your mind drifting away, ask your mind to gently come back. Let's just play this game for another 10 minutes, another few minutes, one breath at a time. As you breathe in, move forward. You will find that your stomach follows you. As you breathe out, you move backward. Okay, now this is an ancient 1,000-year-old technique for preserving life, okay? For preventing premature aging. This is the Taoist technique.